been the biggest change you've seen, do you think?
You know, I think over the 20 years, the focus on good management and growth, right? So, you know, the biggest change I would say over the last 20 years is, you know, we were a hospital system with 3 hospitals in the Mahoning Valley. And we still are that, except now we have 52 medical practices. We employ 400 doctors, 32 primary care doctors, 11 walk-in cares. And so I think that's the biggest change I've seen is it's not just about the walls of a hospital, it's really our 52 practice sites and 400 doctors as well.
Has there been a huge shift from inpatient to outpatient?
You know, I think it's both. So it's not been a shift, it's been a growth. And so we've seen tremendous growth in our community with regard to what Mercy's footprint is. And so our inpatient has grown in size. We've seen more patients now than we have years ago, but our outpatient has just exploded as well.
Right. What would you say that the vision for Mercy has been in terms of the growth over these last 15, 20 years?
You know what, Mercy's been around for 110 plus years in the Mahoning Valley, and with our sisters taking care of patients for 150 years. So our vision is to take care of our community, and to do that we have to continue growing, adding services. We want people to stay in the Mahoning Valley, and so we focus on what physicians we need to stay here, what technology and what locations we need.
People see hospitals closing, and they see it as a bad thing. It's, you know, devastating to a community, but that may not necessarily tell the whole story, right?
No, I think the story that I want to share about Mercy is that we are growing. We continue to add physicians. We continue to add services and locations and new technology to be able to care for our patients. So, you know, we look at the future as one of excitement and of opportunity, with adding new physicians and adding new nurses and technologists and technology to our community.
I'm curious, has it been surprising to hear that in 15 years, 21 hospitals have closed in Ohio?
You know, I think as we look at the healthcare finance reality of America, and we spend a lot of time studying that and understanding the healthcare finance, you know, it is really about scale many times, and as times get rough, the bigger systems have stability. So it doesn't surprise me that smaller systems and smaller hospitals are closing, because there is strength in numbers, buying power, supplies, et cetera.
Some of the things you're going to talk about today, a little bit about the expansion and the growth that Mercy Health has had and the services you guys are offering now. Would you say that those are supporting a gap in healthcare that we haven't had, or it's filling a new need?
You know, I think everything we do is about looking forward. And so as we see where the needs are, in some areas, it's a gap. In our stroke care, what haven't we had that the patients are potentially leaving town for? How can we add that? In our cardiac capabilities, how can we add new technology? So that's one area we focus on. The other area we focus on is how can we bring more patients into our network with primary care? You know, as we focus on the new technologies with stroke care and with cardiac care, we're potentially filling a gap of new technology that wasn't here before, and new procedures and new types of physicians. But we're also adding to our network, adding primary care doctors, adding sites of care. We have 11 walk-in care sites in the Mahoning Valley. That's a large number of places where patients can be seen when they need seen as a walk-in without an appointment. And I think it's also at doctor office prices, which is affordable for patients and easy. So it's a little bit of filling a gap, but it's also opportunity of growth.
You mentioned growth just in terms of the inpatient setting. I feel like we're always going to need those inpatient facilities with the major trauma and transplants and whatever.
Right. You know, as we think about inpatient, you know, that is projected nationally to shrink over the years as more and more healthcare is done in the outpatient setting, as patients are healthier. That's a good thing. However, we still need it. And it actually is growing in our valley. We have more needs with our aging population, and with some of the health problems that we see, we have a greater need for inpatient procedures.
How would you characterize what you see in terms of healthcare here in the Mahoning Valley? Are we in a good position?
You know, we are in a great position. We have a lot of opportunity, a lot of access. We have many points of service. We have more physicians now coming to our community than we have leaving the community, younger physicians who are trained in new technology. And so we are in a good position here in the Mahoning Valley in healthcare.
Does Mercy Health collaborate with any of the other local medical networks like Southwoods and Salem's and stuff like that, or no?
You know, we're the level 1 trauma center, so as patients, you know, are in a different healthcare setting in the Mahoning Valley, we do receive transfers in from their physicians and from their emergency departments and their operating rooms. So when patients are sick and they need transferred in, we do take patients from all of our community partners.
But in terms of continuing to provide people with great access to health care, how important is it that all of you continue to, I guess, expand and grow?
Yeah, I think we look at the needs of, we use our community health needs assessment, and so we see the need for primary care and behavioral health and cancer screenings. And so, you know, I would hope that all of the community agencies and community health care companies that are out there are looking to help make our community healthier, and that is important for our whole community.
Right. This obviously is going to air after August 12th, but I just want to get your thoughts on how big is this new facility in Champion Township going to be?
You know, I think this is growing in all of our community is important, and as we look at growth in the northern part of our region in Trumbull County, we know that there's need for patients to have imaging services and emergency department services. So that is a focus that we've been looking at for years as far as how we grow in all areas, but now even in Trumbull County as well.
Right. You were going to talk to me about a new interventional radiology center you've got opening up here.
Yeah, so we're excited to be able to take care of patients with acute stroke. We've been doing that for years, but we're doubling our capacity with state-of-the-art technology that will help patients with acute stroke, for our physicians to be able to go in and do their best to take that clot, that blockage of blood flow to the brain, remove that to help reperfuse the brain and give that patient a chance for full recovery. And so that's something we're excited to add to our community.
Yeah, you've got one, right? And this is a new one?
Yeah, we've had that service with our one unit, and we're, because of the acumen of our doctors identifying acute strokes and the technology that we use with our CAT scans and MRIs, we're identifying even more opportunity. So we're doubling our capability from 1 to 2, and this newest technology. So that's state-of-the-art care in the Mahoning Valley, and some of the procedures that we're able to do now are even things we didn't do before. So we're growing that in our community.
And you've mentioned it, just the technology. I mean, what's the future of healthcare look like? Is it the technology piece that's just going to enhance what we're seeing?
Yeah, technology continues to grow. We currently have 6 surgical robots for surgery and 2 orthopedic robots. And that type of care, for example, will continue to expand. The artificial intelligence we're embracing. It's out there, and we're embracing that in many areas such as cardiology and radiology to make sure it helps us guide our care. It's not doing the care for us, but we're using that tool.
Right. And then finally, what do you foresee to be the biggest challenge moving forward for healthcare?
You know, I think the biggest challenge is the uncertainty of payment from government or from insurance companies, because I think we do in the Mahoning Valley for everyone. We have a lot of patients who rely on either Medicare or Medicaid. And I think the uncertainty that we have, whichever way that will go, is one of our areas of just opportunity to look at that in the future.
Anything else that you would like to share in terms of what you guys are doing with Mercy Health that you'd like to get?
Yeah, I think as we think about what we've done over our last 100 years, we're looking forward. And we're looking forward to inpatient care with technology and surgery and taking care of sick patients. We're looking at outpatient care, looking at our primary care, our walk-in care, realizing that we are here to serve our community. We serve all patients in our community, regardless of where they come from, ability to pay, and we want to take care of these patients here at home in the Mahoning Valley.
And you've talked about, people talk about the number of beds in the area. You guys have a large number of beds, right?
We do. We have 900. So as you think about the number of beds and how it's registered, the Ohio Department of Health and the state have registered beds. That's the max number of beds patients that we're allowed to take care of. So our max number of beds, that's public, the data is about 910 between our 3 hospitals. That's not really the important number. The important number is staffed beds. Just because you have a registered bed, if there's no doctor or nurse to take care of a patient, then it doesn't really matter. So we have about 900 staffed beds. So we're taking care of that many patients in the Mahoning Valley every day. 900 inpatients, and then in the outpatient setting, last year we saw over 900,000 patients in our practices. That's a very large number of patients that continues to grow. And as we take care of these with our medical practice sites and our hospitals, we know our obligation to the community is to continue to provide that service in the best way we can.